Hi, my name is Morteza Farr. I'm a board-certified orthopedic surgeon at Regional Medical Center. And today I'd like to talk about the new surgical approach for hip replacement and arthritis of the hip. Of course, before we discuss this, we have to discuss what arthritis is. Arthritis is basically a wear and tear of the joint. Our joints are covered with a smooth surface, which we call a cartilage. Over time, unfortunately, we start having wear and tear of this cartilage, and it becomes a rougher surface. Now, what happens when this occurs? Now, with having a rough surface and a more unforgiving surface, as we start having increasing motion and start having activity, it causes pain and discomfort. And over time, because of the increasing wear and tear, we start having bone spur formation, and the bone spur formation result in reduction in range of motion of our joint. Over time, as the arthritis becomes worse, at Regional Medical Center, we like to promote a more minimally invasive anterior hip approach. Joint replacement is a process by which we remove the old and a rough surface and we replace it with a smooth surface. There are different surgical approaches that are available to accomplish this goal. Here at Regional Medical Center, we, as mentioned, believe in a more minimally invasive anterior hip approach. What makes the anterior hip approach unique is the fact that we don't have to cut any muscle to achieve exposure of the joint. All other approaches require the surgeon to cut through muscles to gain access to the hip joint, but not in anterior hip replacement. At Regional Medical Center, we use a special surgical table to allow us to position the patient so we have access to the hip joint by going between the muscle instead of cutting through them. First, the damaged bone and the cartilage is removed. Then the hip socket is cleaned. A metal shell is inserted. A plastic metal or a ceramic liner is locked into the shell, and the artificial socket is complete. We then focus on a femur implant. First, the end of the femur is hollowed out. The metal implant is placed into the top of the femur, and the metal or a ceramic ball component is attached to the stem. The new ball and socket component are joined to form a new hip. A hospital stay is necessary, and the patient will receive physical therapy afterward. In the closing statement, anterior hip replacement offers a minimally invasive approach to hip replacement that allows preservation of the muscle and as such helps function and lessen the recovery time. The patient with anterior hip replacement tend to recover much faster. Their functional and their gait is better. The rate of hip dislocation is significantly less compared to the old method of hip replacement, and their hospital stay is shorter.